There's been an outbreak of respiratory illnesses among children in China, overwhelming hospitals there. But what does this mean for us here, and what should Americans do? I spoke with Desert Regional's Medical Director of Family Medicine, Dr. Luann Carlson. Dr. Carlson, first off, what is going on in China, and should people here in the United States be concerned?
Well, I think what's going on in China is they're having an upswing of RSV virus. That's that respiratory virus that's really dangerous for small children, babies, and kind of older folks. So they're seeing an uptick in children, and I guess their season is kind of overwhelming their system a little bit. I don't think, honestly, it's something that we are to be concerned about here. I think if there was a new pathogen, like a new COVID or something like that, this is usually a normal type of thing that happens this time of year. Why they're overwhelmed, I'm not so sure. I haven't really looked into that really intently, but here we haven't seen that rise so far.
In light of COVID, I think a lot of people might have deja vu, seeing, a situation developing in China and worried if it might have any sort of impact here at home. Is there anything we should be doing differently or just continue on as usual?
I think the thing that we need to really emphasize is vaccination. The county is telling us that people aren't vaccinating like they have in past years. So making sure that our children are vaccinated for RSV and flu and as we go through this season, because it will increase. We're not really seeing the numbers yet even as high as we did last year as far as illness, but we're seeing a downslope of vaccination. So I think that's the biggest thing that we could do for our kids.
Are you anticipating at all a worse than usual flu or COVID season going into the winter months?
I don't think it's going to be worse, but it's definitely not going away. So, there's still a danger. I'm still telling my patients to mask up when they're on the airplane, wash their hands a lot, make sure they're vaccinated.
There are some treatments out there, but they're not necessarily what you think.
Yes, so there are some antiviral medications for COVID and for RSV and so forth for certain individuals. So I think if somebody is sick, it's important to talk to your doctor, make sure you get a proper diagnosis, because there are some medications that may help you have a shorter duration of illness and maybe a shorter severity. So it can mean the difference of survival or not surviving. Yeah.
All right, Dr. Carlson, as always, we appreciate your time. Thanks so much for joining us.
Thank you.